Knock, knock, knock. Hi, I'm Cassandra, a nursing student. I'm looking at the physician's orders, and it looks like he ordered a eyes, ears, and neurological assessment today. Can I get you to verify your last name and date of birth, please?
Carassa, 42594.
And do you have any allergies while I look at your wristband?
No.
Okay. I would close the door for privacy, wash my hands, and put on my gloves. I've brought all my equipment in here with me. Are you comfortable in the chair?
Yes.
Awesome. First, we're going to assess your eyes, and I have 3 questions for you. Have you had any blurry vision?
No.
Any injuries to your eyes?
No.
And any history of glaucoma?
No.
Awesome. First, we're going to assess your peripheral vision. So I'm going to have you cover up one eye and just let me know when you see my finger come into play. And we're going to go clockwise, and I'm going to be about 60 to 90 centimeters away here. Okay, here we go.
Yes. 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 Yes.
Okay, and let's do the other eye, please.
Yes. 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 Yes.
Awesome. And just looking at your eyes, they look even and symmetrical. All their eyebrows and eyelashes are even and symmetrical also. We're gonna assess your 6 cardinal fields of gaze here. So basically, I'm looking for any wiggling of your eyes. Just follow my finger. Good. There's no wiggling of your eyes at all. And you move parallel together. Now we're gonna test the cover and uncover test here. That's my note card for reading later. I'm gonna cover up one eye. I'm gonna have you look straight ahead, and I'm basically gonna see if the other eye moves at all. Cover, uncover, cover. Good. There's no movement in the eyes. I'm gonna have you still look straight ahead. Good. And there's no movement in that eye either. And by just looking at your eyes, I'm looking at the alignment and the color of your eyes, and they're moist, they're clear and bright, and they're symmetrical, and there's no lesions present, and your eyes are green. And looking at your eye lashes, they're symmetrical, evenly distributed. There's no infestations or crustaceans. And looking at your eyelids here, they are pink and moist. There's no crusting scales or lesions present, and there's no redness or swelling. I'm looking at your lacrimal glands now, and there's no drainage or redness or swelling there either, which is good. And I get you to pull down on your eyelids here. I'm looking at your conjunctiva, and they're light pink and moist, which is great. There's no lesions there, and there's no redness or swelling there also, which is great. Okay, you can let go. I'm looking at your sclera, and that's a nice pink, wow, nice white, glistening. Good, there's no lesions. I'm gonna look at your cornea lenses here, and with my pen light, so just look straight ahead. This is good. And those are, they're bright and clear, they're glistening, and there's no lesions present either. It's just great. Now I'm gonna look at your irises and pupils. Your irises, sorry, are green, and they move parallel together, and your eyelids move freely also. And your irises, there's no lesions or anything either. Your pupils here, they are symmetrical, they're same size and shape, and they're round, which is good. Next, I'm going to do the pupil reaction test. So I'm going to dim the lights, and we're going to look at your eyes. and watch them constrict and dilate. There we go. Okay. And here I'm just watching your eyes. I'm going to shine the light in this eye, and we're going to watch it constrict. And once I take the light out, it should dilate again. Okay, there it goes to constrict. We're going to look at this eye, and the pupil constricts. Awesome. And now they dilated both again. I'm going to shine the light in this eye, but I'm going to look at this eye to make sure it constricts. Okay, awesome. It constricts. The same thing. I'm going to shine the light in this eye. Look at this eye. Awesome. They constrict. And now they both dilated. We're going to turn the light back on. Okay. And now we're going to do the pupil accommodation test. So I'm going to have you follow my pen light here. And as I get closer to your nose, your pupils should constrict, and I get further away, they should dilate. So here, they're constricting. And now they're dilating. Good. Awesome. That's good. And now I'm going to have you close your eyes. I'm going to kind of palpate your eyes and your globe of your eyes here. Close your eyes, please. Palpate. Those are firm, non-tender, and there's no drainage or lesions present there, which is good. I'm gonna try to feel for your lacrymal ducts and glands here. Good. And those are non-tender and they're non-palpable, which is good. I'm gonna have you read a line for me. Can I just have you read this top line, please?
Southwest Technical College Clinic Home Version.
Awesome. Thank you. And next, I'm going to move on to the hearing, okay? Excuse me. By just looking at your ears, you can kind of tell that they're symmetrical, they look smooth. The placement is the same. They're the same skin color, the same shape and size, the same color as your skin, sorry. And I'm gonna ask you 3 questions here. Have you had any hearing loss?
No.
Have you had any ringing in your ears?
No.
And have you had any pain in your ears?
No.
Awesome. And now I'm gonna palpate your ears, okay? Let me know if this hurts at all. And there's no lesions, it looks like here. I'm gonna pull up on the article, fold the pinna in, push the tragus, and palpate the maxillary process. Was there any pain or anything there?
No.
Okay, awesome. And the skin is soft and smooth there. I'm gonna pull up on the tragus, fold the pinna, pull up on the article, fold the pinna, push on the tragus, palpate the maxillary process. Was there any pain in that at all?
No.
No? Okay. Next, we're going to look in the ears. If I had an otoscope, I would be holding it upside down and having my arm up against the head. I don't have an otoscope here. And I would make sure I would look in the ear that doesn't hurt first if you had any pain, because I didn't want to cross-contaminate infection here. So I'm going to use my pen light. And for adult, you pull up and back, and for child, you pull down and back. So we're going to pull up and back. We're looking at the ear canal and the tympanic membrane. And the ear canal is a light in color, and tympanic membrane is a pearly gray. And those are both good. We're going to come over here, do the same thing with this ear. Pull up and back. Look at the ear canal and the tympanic membrane. Ear canal is a light in color. Tympanic membrane is a pearly gray, which is great. Next, we're going to listen for the hearing test. So basically, I'm going to say 3 numbers, and I'm going to have you repeat them back to me. Can I get you to cover one ear, please? 5, 7, 8.
5, 7, 8.
Awesome. And can I get you to cover the other ear? 1, 10, 5.
1, 10, 5.
Awesome. And I'm going to have you close your eyes, and I want you to tell me which side you hear my fingers at, okay?
Okay. Left. Right. Right. Left. Both.
Awesome. And now we're going to move on to the neurological assessment here, okay? So I'm going to so this whole time I've been looking at your behavior, your facial expressions, and your posture and your grooming, and which all seems to be good. And normal, I should say. And now we're going to assess like the alertness. So you're alert to person because I've already asked you your last name and date of birth. And time. Can you tell me the month, please?
September.
Awesome. And can you tell me the place of where we're at?
The hospital.
Okay. And we're going to, the situation, can you tell me like what we're doing here?
General checkup.
Awesome. All right. And now we're going to move on to the memory. So I'm going to assess your immediate memory. I'm going to give you 3 numbers. I'm going to have you repeat them back to me. 3, 7, 9.
3, 7, 9.
Okay, and can you repeat those backwards to me?
9, 7, 3.
Awesome. And now I'm going to assess your recent memory by saying 3 items, and I'm going to have you repeat those 3 items back to me later on the assessment. Marker, watch, shirt.
Marker, watch, shirt.
Awesome. And I've already assessed your remote memory by asking you your date of birth. Okay, so now we're going to move on to your cranial nerves. And the first cranial nerve is your olfactory. So I'm going to assess with patency, and I'm going to have you smell something, okay?
Okay.
So can I get you to plug one side of your nostril and breathe in? And then can I get you to plug the other side of your nostril and breathe in? Good, there's good patency. And can I get you to close your eyes and smell what I have and tell me what it is?
Toothpaste.
Good. All right. And the next one is optic, and that's reading. So I'm going to have you read the smaller version of my line here.
I can read the small line.
Awesome. What? You want to look at that?
Oh, I can read this small line.
Good.
Yes, I can't read.
All right. And we've already done nerve 3, 4, and 6. Your ocular, motor, trochlear, and abducens, and that was the 6 cardinal fields. Those were testing your eye movements, which is great. And now we're going to do nerve number 5, and that's your trigeminal nerve. And I'm going to have you close your eyes, and I'm going to just let me know where I'm touching you at, okay?
All right. Forehead, cheek, other cheek, nose, chin.
Awesome. And next is your facial nerve. Can I get you to smile? And can I get you to frown? And can I get you to puff out your cheeks? Awesome. And that was nerve number 7. And next is nerve number 8. And that's your acoustic nerve, and that was your hearing. And we've already tested that with repeating the numbers on my fingers. And number 9 and 10 is your glossopharyngeal nerve and your vagus nerve, and that's your gag reflex. So I'm going to have you stick out your tongue. I'm going to place this tongue depressor on you and say, ah. Awesome. And number 11 is your accessory nerve. So basically, I'm going to have you shrug your shoulders. Awesome. And number 12 is your hypogonadism hypoglossal nerve, and that is the movement of your tongue. So I'm gonna have you stick out your tongue and move it side to side. Awesome. Thank you. And next we're gonna assess your superficial sensory. So basically I'm gonna have you close your eyes and just tell me where I'm feeling you again, okay? Touching you at.
Shoulder.
What shoulder?
Right shoulder.
Awesome.
Left elbow.
Awesome.
Right thumb. Left knee. Right knee.
Awesome. And now I'm gonna do your fine motor skills, okay? So basically I'm gonna have you touch your nose and you're gonna touch my finger and then go back to your nose, okay? Good job. And next we're gonna do the Basinski test, okay? I'm gonna have you kick off your shoe, please. And I'm gonna go up and sideways here. And that's good because with babies, the toes flare and your toes didn't flare. So you have a good normal response, which is great. I guess we could do this foot too. Good job. All right. We did the Brzezinski. Now I'm going to have you repeat those 3 words back to me, please.
Marker, watch, shirt.
Awesome. Great job. Is there anything else I can do for you today? I have time.
No.
All right. And then I would document and communicate with the doctor my findings.